Welcome to the fourth episode of RocksTalk, the podcast of Aggregates Europe UAPG, where we'll delve into the crucial topics that shape our industry and impact our daily lives. My name is Manon Graffet, and I work as a Public Affairs Officer at Aggregates Europe UAPG, and I will be your host for the next 20 minutes. Today, we will have a special episode focused on health and safety within the aggregates industry. Joining us today is César Loases Frades, the chairman of the Health and Safety Committee at Aggregates Europe UAPG. With years of experience and a deep commitment to ensuring the well-being of workers, César is here to share insight into the challenges, innovations, and future direction of health and safety in this essential sector. We will be discussing a range of topics, from the functioning of the Health and Safety Committee to the implementation of new safety measures and the impact of European policies. Whether you are part of the industry or simply interested in how safety standards evolve, this episode promises to be both informative and engaging. César, good morning. To start off, could you tell us a bit more about your role, your background, and the primary objectives of the Health and Safety Committee at Aggregates Europe UAPG?
Good morning, Manon. First of all, my background, I'm a doctor mining engineer. I've been working for the aggregate industry for more than 30 years, and I've been involved in European affairs at UAPG level during the same period of time. As objectives of the Health and Safety Committee of Aggregate Europe, I have to say that for this industry, this quarrying industry, health and safety is a first priority. It's already included in the roadmap of the industry for 2030. And I can say that this is the first committee reporting to the board and the delegate assembly. I mean, this is a top priority for the industry and for the European Association. Our priority, of course, is the health and the safety of the workers in our sites, in our 26,000 sites of aggregate across Europe. You know that quarries activities are complex in terms of the management of the site, because we are interacting with the nature, with the rocks. We are working on open air, etc. And we have to, manage all the factors in the quarries, trying to arrive to minimize, or the optimum is to go to zero accidents in the quarries. In fact, we have few accidents in the aggregate industry, but the severity of the accident is high because of the machinery we are using. That is a very big one, equipment, mobile equipment and fixed equipment. So this is a big challenge, and this is in the focus of the committee, of course. In this committee, we are also following accidents and indexes to follow up the evolution of the accidents, and we are looking to a permanent improvement. UAPG and member association, we have the leadership in health and safety for the aggregate industry integrated in SMEs.
Thank you. My next question would be about the industry challenges and safety measures that are already concerns the industry. So, according to you, what are the primary health and safety challenge in the committee? You have already spoken a bit about it. And what are the measures that are being implemented right now to address these challenges?
Yes, thank you. First of all, I was mentioning before the machinery and the equipment. We have a production process where the workers are isolated. Each one is managing or using one machine or a group of machines. These machines have to be safer by design. So for us, the safe use of the working equipment is a top priority, and also the compliance of all the safety rules we have in the industry. As I explained before, we are working in a changing environment. It's open air quarries and sand and gravel pits. We are exposed to weather conditions. We are, let's say, changing the shape of the quarry every day by extracting the material. So we need that everything remains safe in these difficult conditions. And we, in general terms, we are successful in doing that. For us, it's important to work and this is a challenge, to improve the behavior of the companies and the workers in health and safety, to try to promote a culture for the workers and all the staff where the safety is and the health of the workers is in the front line of the work, even more than the production. So this is a relevant topic because it's demonstrated that a safe operation is a more productive operation and not the opposite. Another point is that we are dealing with a specific regulations, so we need to adapt to the evolution of these regulations. And also nowadays we are focusing on topics related with health, which is a top priority for European Union and national government, and then of course also for our companies.
Okay. And in this kind of challenges, what could they be? You said that the sites are open sites, so there can be dust. What are exactly the problems with dust or other kinds of problem?
First of all, we have the in relation with accidents, because I will come then to the problems with health and then to dust. The problems related with accidents could be a rollover of machinery, interaction between the machines and the pedestrian, and the people entering in the site without control, which is in principle not possible, but it happens sometimes. We are... and because we are in open air, exposed to weather conditions, they may have some issues with electricity in the fixed machinery. So this is the kind of big risk of accidents we have to manage. Concerning to health of the workers, we have noise, which is important. The equipment nowadays is more and more prepared to comply with all the acoustic emissions in order to safeguard the people. Also, we have issues with dust, but we have a very stringent and very important regulation concerning dust and respirable crystalline silica. I will come to this later on, but this is not. This is a big topic, but we think that we are doing our job managing this risk. We have other musculoskeletal disorders is also an important disease for our workers, so we need to, let's say, adapt the job post to the characteristic of the different workers that are using this machine or this work job. So we have a number of different issues to be tackled, but I think we are able to solve them. And also, I didn't mention, but we are using explosive in the quarries for blasting, for breaking the rocks, in order to be clearer. And but this is a very safe operation. I mean, nowadays the detonators, the explosives are very, very safe. The technical requirements are very strict, and the regulation are also very strict. So I think this is an operation, the blasting, drilling and blasting, where the risk is very well controlled also.
Okay, thank you very much. But this leads us to the next question about the regulations. I would like to know a bit more about the health and safety regulations in the European Union. So according to you, how do evolving regulation within the EU impact health and safety standards in the aggregates industry? And can you share some of the examples of innovative policy developments that are helping to improve safety outcomes in this sector?
Yes, first of all, the regulation, the framework regulation on health and safety in Europe is very, very large. We have a framework directive on health and safety with 24 daughter directives in many, many different issues, machinery, noise, and chemicals, etc. But also we have a specific European regulation for the extractive industry. So we have the general framework plus a specific one. And in addition to that, in some member states, we also have a national regulation to be applied. Nowadays, the evolution of the regulation at European level is going towards, or is moving from the accident to the health control, because according to the statistics from Eurostat, the number of diseases, no, I'm not speaking about aggregate industry, I'm speaking in general terms. In Europe, the number of diseases by accident, the number of deaths by accident is about 10,000, but the number of diseases, death by diseases due to worker job conditions, it's about 12 times more, 120,000 in Europe. So this is a very, let's say, top priority nowadays for the regulators, for the Commission, European Parliament. So nowadays we are facing a lot of amendments and changes in the regulation related with chemical, with carcinogens, etc., which is a completely different approach, because European Union want to cut completely this kind of diseases for the workers. And of course, we agree with this approach because these are facts. Concerning what is happening in our industry, we have few deaths per year, but nevertheless, we are, let's say, working, all of us, very committed to achieve a zero accident and zero fatalities. And also concerning the health of the workers, we are working a lot in fields like noise or like respirable diseases due to respirable crystalline silica.
Okay. But how can you explain this shift from regulations more focused on accidents and now more on disease? Is it because of scientific research?
No, it's mainly due to evidence. According to the statistic, even if we still have around 10,000 deaths per year in Europe due to work, the tendency of this, the trend of this evolution is positive in terms that there's a continuous reduction. So now all the efforts are placed in these other health conditions and health requirements, because the number of deaths per year is 12 times more, as I said. So according to this, the approach of the Commission is, let's say, try to set different new requirements, stringent limit value for some agents, etc. So there are different approaches. Of course, let's say the change is led by the facts, by the accidents, what is recorded. But let's say the evolution of the regulation is also, of course, based on scientific studies that allows the policymakers to try to establish more safer and more secure limit values for the workers for different kind of parameters.
Okay. But so I suppose that when it comes to regulations, we need to implement them very well. So I suppose that collaboration and partnership with health and safety organization or association must be key. So does the European aggregates industry face its challenges of health and safety alone, or does it collaborate with other sectors and organizations?
Of course, we need to be together with other actors to be able to achieve good improvements. So, for instance, we are partners of EU OSHA campaigns. since many years. I have to say that UOSHA campaigns are, let's say, targeting important transversal risk. I mean, digitization, chemicals, aging, etc. So they are tackling big topics. So where we are participating in these campaigns because we also need to tackle these issues in our quarries. We are also member of NEPSI. NEPSI is a social agreement where we are together thanks to the support of the Commission with the trade unions. And this NEPSI agreement is working for respirable crystalline silica improvements and measures. We have a very good platform there, nepsi.eu, where we have a lot of tools for training, to explain to the workers, etc. We made a yearly, bi-yearly collection of KPIs to see the evolution, etc. We also collaborate with the other extractive industries in Europe through the NAPE, where we try to have similar approaches to same issues in order, let's say, to be coherent and to facilitate the work in the real field, in the quarries and the mines in Europe. And also we are member of the Social Sectoral Dialogue Committee for the Extractive Industries, where some European Association for the Extractive Industry, we have a social dialogue with the trade unions in order to make the health and safety and other topics, but mainly health and safety, evolve in a positive way for the whole industry.
Okay, very clear. For example, just one question about NAPE. What are the examples of issues that can be shared by other organizations or sectors within the extractive industry?
One good example is respirable crystalline silica, but also machinery. It's important. Also things related with explosives, the track and trace of explosive and many others. So it depends also on what is, let's say, on the focus on the Commission in each moment. So we are trying to have to adapt our focus on the priorities of the Commission. So we are collaborating with them most of the time.
Okay. And how about best practices and awareness? How does Aggregates Europe UPG ensure that workers across the industry are adequately trained and aware of best practices in the health and safety? Are there specific training programs or initiatives that have proven particularly successful? And finally, how does the committee foster a culture of safety, as you said before, among member organizations to prevent incidents before they occur?
Concerning the best practices and awareness, one important thing that UEPG is doing is to know the good practices applied and developed by the different member associations in their countries. So we are sharing campaigns that one association is preparing and implementing successfully. For instance, the campaign Safer by Design, a zero accident campaign, a campaign from MPA from UK on pedestrian, other campaigns focusing young people that enter to the quarries just to have fun and may have an accident. So we are trying to raise the awareness not only internally with the workers, but also with the people that could have an accident by a bad approach to our industry. Other things to raise awareness is that we are developing in the Health and Safety Committee toolboxes. According to the statistic we have in our sites and we are sharing, we identify what are the key topics, the key priorities, and we try to deliver tools that are in principle prepared in English but could be adapted to the different countries very quickly by the different members. So this is another important thing. And also, I mentioned before, we are sharing the campaigns of EU OSHA to our members. It's important to say that EU OSHA, it's a network of national health and safety agencies. So in principle, in the network of EU OSHA, we have every brochure is prepared in every language of European Union, which facilitates a lot to deliver this information to the workers. And the same for NEPSI. NEPSI has developed a lot of tools, not only in English, many of them are in different languages. So it's difficult to reach 26,000 sites across Europe, but the digital tools are a very good way to facilitate this information and to spread the culture, health and safety culture, to the members and to the quarries, and then also to the workers.
All right. So my last question would be then about the future. Having spoken about best practices, implementation of regulations, challenges, and health and safety issues, we can look ahead. For you, what are the key goals and strategies of the health and safety for the next few years? How do you plan to measure progress and success in achieving these objectives?
It's difficult to answer to this question because, first of all, we need to continue to work in all the topics we are working in, because it's not because we are improving that we need to, let's say, forget them. We need to continue to work on accident prevention, health protection, etc. We are trying to improve the tool to collect the information on accident from the members in order to have better figures and then to be able to track more accurately the different accidents and the different information from the members. Important is we need to think about this to try to increase the support to the members and to the companies, and in particular to SMEs, because this industry is integrated in majority by SMEs. The average of workers per quarry, it's about 10. So there's not a lot of people in a quarry. As I said before, they are isolated in the work, so they need to be collected. They need to be very well organized. And this is a challenge to, let's say, deliver tools that are useful for SMEs. That's another important point. Another additional point is that even due to the evolution of the jobs and the technology, we are facing nowadays new risk that were not in our scope, let's say 10 years ago, like digital adaptation, green jobs, and of course what I said about health. And then we have two issues. One of them is to reskill the people, because we have the technologies are changing very, very fast, and we need to have a very well-skilled workforce able to be, on one hand, very productive, but more important, to be to have a safe behavior of the work. So they need to be very well informed about everything that is on their hands to be safe. And the last point I want to mention is that this industry is facing the same problem that the majority of the industry in Europe, which is the aging of the workforce. It's difficult to attract young people to our industry. And then we have, first of all, older workers, so we need to, let's say, make their work easier in order to, let's say, to keep them as much as possible in the work within the companies. But also, we need to attract young people, showcasing that we are a safe industry, a modern industry, an industry where we have a good technology, where the persons are first and then the job is in second place, because this is the way to have an industry for the future.
Okay, thank you very much, César.
Thank you.
Thank you for joining us today. I think that now our listeners will have a more comprehensive understanding of health and safety issue in the aggregates industry. So thank you very much.
Thank you.
And the next podcast of Aggregates Europe UPG will be after the summer break at the end of September. Stay tuned.